society is changing. It is much more multicultural than ever before. The age profile is changing as people live longer. Today, there is a much higher percentage of people aged over 65 in our population. The majority of older people in Ireland live at home or with their family. Increasing numbers of older people live in a residential care setting. Residential care can be operated by public, private or voluntary services. It is everybody's right to lead a life free of abuse, regardless of their ethnic or cultural background, religion, political persuasion, gender, sexual orientation, disability or age. Preventing abuse is everyone's responsibility. All older people have a right to be supported to live a meaningful life connected to their family and friends. All of us who have regular contact with older people have an essential role to play in protecting and promoting this right, as well as a good quality of life for older people. The training DVD you are about to watch was filmed using professional actors. No actual patients or staff were filmed in the making of the DVD. The DVD does not set out to portray best practice in relation to personal care, manual handling, or general care giving. The scenes portrayed are based on national and international research on elder abuse. Some scenes can be quite shocking and disturbing. If you feel you may be distressed by the content of this training DVD, please speak with your line manager. Abuse can happen to an older person in their own home, in a daycare centre, in a residential care facility or nursing home, in a hospital, in sheltered accommodation or in boarding out. In all of these settings, harm and abuse can be caused by family members, neighbours, paid healthcare workers or volunteers. Indeed, elder abuse can be caused by anyone. This training programme has been designed to assist all staff working in residential care settings to recognise elder abuse and poor care practices. It will also inform you of the correct actions to take if you discover or suspect elder abuse. All of us working in residential care settings, such as nursing homes and public long-stay facilities, have a duty to provide the best quality of care for older people while respecting the older person's civil rights, privacy and dignity. All staff in a residential care facility, care assistants, nurses, doctors, social workers, therapists and administrative staff should be aware that they can be complicit in elder abuse and poor care practices. This DVD and training manual are designed so that they can be used together as part of a training programme. The problem of elder abuse was highlighted in the 2002 report, Protecting Our Future. International research has shown that increasing numbers of older people experience regular abuse in some form.
Come on, slow coach. It's time to go to the dining room for dinner.
Ouch, that hurts.
In addition to Protecting Our Future, this training DVD aims to support you in meeting the criteria set out under Section 8, the protection standard of the National Quality Standards for Residential Care Settings for Older People in Ireland, as published by HSE.
I just want to visit my friends.
Sure, you wouldn't have any idea where to find them. Anyway, you have no friends, they're all dead. Come on back.
The report Protecting Our Future defines elder abuse as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person or violates their human or civil rights. In order to understand and identify abuse, all of us need to observe and think broadly,
Just checking your pad.
so we do not overlook or accept situations of abuse as normal.
Put this on now. That's not my dress.
Go on,
No.
Helen. Come on, put this on now. Can everyone come in? Slow coach.
It is common for an older person to be experiencing more than one type of abuse at the same time. An act of abuse to an older person may be against the law and may be considered a crime. Abuse is a violation of an individual's human and civil rights by another person.
Okay, eat the food, Anne. Okay, stop pushing it away.
In a residential care setting, an older person may be abused by a partner, spouse, child, relative or friend, a visitor to the residential facility, a health, social care worker or other paid worker, clinical staff, therapists or administrative staff, or by a volunteer worker. Protecting Our Future recognises 6 types of abuse. They are physical abuse, psychological abuse, financial abuse, sexual abuse, neglect, and acts of omission and discrimination. Most elder abuse occurs at home. However, a significant proportion of elder abuse occurs in a residential care setting, out of sight of the general public.
You're not listening, you're not paying attention.
Helen, you fell again yesterday. Now keep this in front of you.
But I'd like to get around the place.
It's for your own good.
Caring for older people is a rewarding but sometimes challenging experience. The majority of incidents of abuse occurring in a residential setting are not deliberate, but are a result of poor work practices, lack of proper training, thoughtlessness, ignorance or time pressure.
Mary, I want to go to the toilet.
In a minute, love. Don't worry, you're wearing a pad.
Abuse can be a result of inappropriate care plans for individual patients or neglect. If we witness poor care practices or do not challenge questionable attitudes towards older people, we contribute towards condoning abuse. Only in a minority of cases is elder abuse a deliberate act.
Thank you very much. Me and my sister will be on holiday.
It is important we realise that the signs of abuse described in the following sections of the programme are only indicators that abuse may be happening. Behaviour and injuries of the type we describe may be present for other reasons. Physical abuse is the injury or mistreatment of an older person through the use of physical force or the threat of physical force. Physical abuse can be deliberate or accidental.
You'll have me.
Come on now.
This before you finish with me.
I'll hurry up.
It includes over-medication or the withholding of medication,
Keep it quiet.
force-feeding, and the inappropriate use of restraints. Physical abuse may be inflicted directly with a fist or a foot or with a weapon such as a belt or a hairbrush or by burning with a cigarette. Rough handling during caregiving is also a form of physical abuse. The abuser may conceal injuries to prevent the abuse being discovered.
Did you have a fall?
No.
It's so nasty. Who did it?
It is important that those who are helping older people with personal care take notice of any bruising or other marks in unusual places. Incidents of physical abuse. Many of the routine tasks that carers need to perform can result in a situation where physical abuse can happen. Some residents may react aggressively to being bathed or washed. Staff should anticipate these situations and seek help and have an appropriate care plan in place. There are also dry hygiene products available, which can be used as an alternative to washing or bathing.
Joe, stop it. Do you hear me? Stop with the drama. We're just having a shower. It's not the end of the world.
On occasion, a resident may behave aggressively towards a staff member by striking them, attempting to strike them, or by being verbally abusive. It is important that staff react to this in a sympathetic way and try to calm the older person. Inappropriate use of restraints by carers can be a form of physical abuse.
I hate being tied up like this.
Using a recliner chair when a resident does not really need to be restrained in this way.
It's not right.
Also, inappropriate use of lap belts to restrain a resident in a chair or a bed could be seen as physical abuse. The use of bandages as a restraint is not acceptable. Many patients are not at risk of falling out of bed, so using bed rails to restrain them at night may not be appropriate. Refer to your organisation's restraint policy for further information.
Joe, stay in the bed. If I will have to strap you, I will strap you.
Failure by carers to use a hoist to assist a resident from their bed or a chair and using rough handling to lift them is a form of physical abuse. Carers and nursing staff should be properly trained in the correct procedures before using a hoist to lift a resident. Carers must also be aware that being lifted by a hoist can be a frightening experience for an older person.
Come on, Molly.
Some residents may resist or resent being assisted to use the toilet.
Be good, Molly.
I'm okay.
Or staff may use a commode rather than taking them to the toilet. Giving residents their medication can cause problems for staff. Residents should not be coerced into taking medication.
I don't want it.
If you don't take it, you will end up to hospital.
I don't want it. I don't want it.
Take it. Take it. That's it.
Guidelines should be followed when crushing or disguising medication. The older person's family and their GP or medical officer should be informed when an older person is refusing to take their medication.